Research has shown that basic oral hygiene prevents cavities and gum disease, improves bad breath, and improves one's ability to chew. If you don't take care of your teeth, bacteria from chronic oral disease can enter the bloodstream and interfere with healthy blood flow. Chronic oral infections have been shown to contribute to aspiration pneumonia, the leading cause of death from infection for those above age 65. Regular oral hygiene has been shown to reduce the chances of death by aspiration pneumonia by as much as 33%. This means that daily toothbrushing will not only improve quality of life, it may actually help us live longer and healthier lives. Some people need help caring for their teeth every day. How can family members or professional caregivers help deliver daily oral hygiene to those in their care? Here are the basics. For anyone with natural teeth or dental implants, daily oral hygiene involves a few minutes of gentle mechanical scrubbing of teeth and gums. This basic brushing can be done with manual, electric, or specialized brushes. Floss, picks, and other devices can also be helpful in cleaning hard-to-reach areas. Mouth swabs, sometimes called toothettes, are not designed to clean teeth and should not be used in place of a proper toothbrush. Toothette can be used to transfer water or other moisturizers into the mouth or to wipe the gums. Mouth rinses can help, but are not enough to remove sticky plaque buildup. Gentle mechanical scrubbing is still needed. Ideally, this routine would occur after every meal, but at least twice a day. The goal of this routine is not just to remove food debris from the mouth, but more importantly, to remove the growing biofilm of bacteria coating the teeth and gums. Even if an area looks clean, the microscopic bacteria need to be regularly scrubbed away to prevent overgrowth of bacterial plaque. Keeping the bacteria under control reduces the chances that bacterial overgrowth will enter the lungs or bloodstream, and reduces the chances of pain from cavities or gum disease. This will also improve the ability to chew and will lessen bad breath. To help someone brush well, it's important to see what you're doing. A headlamp or flashlight can be a big help. Consider starting each brushing session with little or no toothpaste. This prevents too much foam from building, which can block your view of inside the mouth, or can cause choking or coughing for the person you're helping. The most important goal is basic plaque removal, gently scrubbing the invisible bacterial film off the teeth and gums, so it does not multiply into a large buildup of germs. The brush can be wiped clean with a paper towel or rinsed. If available, a suction unit can help remove saliva and dislodged debris. Remember to use good lighting and ensure that all corners of the mouth have been cleaned. Other tools, like flossers or small brushes, can reach bacteria hiding between teeth or behind bridges and dental implants. The tongue can be cleaned using either a toothbrush or specialized tongue scraper. This step should be performed only on patients who can tolerate it comfortably. After the gentle scrubbing has been completed, a small amount of anti-cavity or antimicrobial toothpaste can be applied, unless otherwise recommended by a dentist. For anyone with removable full or partial dentures, these appliances should be removed and cleaned several times a day and should not be left in the mouth overnight unless recommended by a dental professional. Dental appliances can harbor bacterial plaque and, if not removed, can cause gum irritation or infection. Dentures are expensive and can be surprisingly fragile. Be careful to prevent dropping or breakage. Normal toothpaste and toothbrushes may be abrasive and may permanently damage dentures. Running tap water and a soft denture brush are good first steps in removing plaque, and use denture adhesive. Follow this with soaking dentures in a denture cleaning solution. Some denture cleaners are designed for overnight use, some for shorter time. Misuse may cause damage, so follow the instructions. Do not use mouthwashes or alcohol to soak dentures. With dentures or appliances removed, the gums and tissues of the mouth should be inspected and cleaned of any debris or plaque buildup. When reinserting the denture, some but not all patients will use a denture adhesive to get a better fit. In general, use as little adhesive as possible. During all this, everyone's safety and ergonomic positions are important. The need for personal protective equipment like gowns, masks, face shields, and gloves may depend on if you are a professional caregiver or if you are a family member of the person being helped. Use the level of PPE appropriate for your situation. Body positioning will directly affect how well you can perform the basic tasks, and it's important that you and your patient are both physically comfortable, so you can continue this routine every day. We recommend being beside or above your patient, rather than directly facing each other. Use good lighting and familiarize yourself with the best hygiene aids for each person. Find a position that works for you and your patient, perhaps moving the patient if necessary. Don't lean too much or otherwise compromise your muscles or posture. Your goal is to make this a comfortable experience, one you can repeat again and again. So take some time and find what works. Now we'll demonstrate these tips. Prepare your needed supplies in advance. These may vary based on individual preferences. Decide what level of personal protective equipment is appropriate for your situation. Use good lighting so that you can clearly see inside the mouth. Find an ergonomic position that allows everyone to be comfortable. Consider standing beside or above your patient. This promotes good ergonomics. Avoid a direct or face-to-face approach. This position could actually make it more difficult for you to clean all corners of the mouth. If your patient is reclined, try to move the patient to the edge of the bed closest to you and position them as upright as possible. Whether you're using a traditional, electric, or specialty toothbrush, start without toothpaste to avoid foam. Toothpaste can be applied at the end of the brushing. If using a manual brush, maintain light grip strength. Consider holding the toothbrush with 3 fingers to avoid overbrushing or damaging the teeth or gums. If using an electric brush, gently move the brush along the teeth and gums. Let the electric brush do the work. Be gentle. Vigorous overbrushing can cause gum and tooth damage. Be sure to brush all surfaces of each tooth, and beware of difficult-to-reach areas behind the back molars and near the tongue. Rinse or wipe the toothbrush as needed. Floss or floss picks can clean between teeth. Those with larger gaps or bridges may benefit from other dental aids like interdental brushes. Again, mouth swabs, also called toothettes, are not designed to remove plaque from teeth and should not be used in place of a proper toothbrush. Be prepared to help your patient rinse or spit, or the mouth can be swabbed clean with dry gauze. After the mouth has been cleaned, a small amount of anti-cavity fluoride toothpaste can be quickly applied and left on the teeth without rinsing. For patients with difficulty opening their mouths, a reusable foam bite stick can help ensure safety for everyone. Position the bite stick on one side of the mouth between the teeth, and twist it to rest the mouth open, allowing you to clean the insides of the teeth on the opposite side of the mouth. Those with removable full or partial dentures should have their dentures cleaned several times a day. Normal toothbrushes and toothpastes should not be used to clean dentures. Instead, use specific brushes and water to gently remove debris. Dentures can be freshened by soaking in denture cleaner. Follow the instructions for the cleaner. Do not use common mouth rinses to soak dentures. If used, denture adhesive should be limited to as little as possible. When you're all done, rinse off all supplies and keep them in a convenient place for use multiple times a day. Do not share supplies, including toothpaste tubes, between patients. Although your primary goal is to help your patient by removing bacterial plaque from the mouth, keep an eye open for anything that doesn't seem right. You may discover cavities, ulcers, swellings, infections, or other issues. If uncertain about anything you see, inform your patient, the family, or nursing administration. A dental professional may be needed, and by calling attention to the issue, you may have saved the day. The process of caring for teeth and gums is personal and intimate. It is a caring and loving activity that should be as gentle as possible. It can be an opportunity to build and demonstrate trust and respect between caregiver and patient. We hope that with these basic tips, you can be comfortable helping those in your care improve their physical health and quality of life. Our ability to socialize, eat our favorite foods, and enjoy pain-free mouths are all elevated with some basic daily hygiene.